The February 25th meeting of the Transportation Committee will now come to order. Madam Clerk, could you please call roll?
Ms. Andrews? Dr. Carbone? Chairman Colby?
Here.
Mrs. Draw? Mr. Gamina is excused. Ms. Cayley? Mr. Lightfoot? Mr. Marionetti? Dr. Quattro? President Adair?
Is there anyone sign up at public forum?
There is not.
Is there anyone present that would like to address this committee? Seeing none, before we get started, I'd like to say I'm taking the liberties here, as our president has about a plan a month. We're going to have a vegetable or food item of the month for this committee. This month, it's cabbage. Cabbage is one of those products that is very good for you, coleslaw. And coming up this month is in March. Everybody knows we're supposed to eat cabbage for St. Patrick's Day. But did you know that cabbage is number 1 or 2 in New York State, especially Western New York State? We have the most storages for cabbage anywhere. It's one of the few states that produces cabbage year-round. You can buy cabbage out of New York State storage. So when you're sitting down and you want to eat healthy or see some of your constituents, and you might want to let them know to eat cabbage, be good for their health. Next item in the minutes of the proof. What? Question? Go ahead. Questions?
Is that cabbage from your farm?
Yes.
Is the cabbage used in egg rolls at the farm?
Yes.
It's awesome.
Yes.
How many acres of cabbage do you grow every year?
We grow between 100 and 150.
And how many ton of cabbage?
About 30 tons to the acre.
How many cabbage are there per ton?
I don't know. Depends on the. What? No, we're not going to go down that road with the Ethics Committee. And just for you know, this cabbage, if it was another 2 weeks from now, it would be a year old. That cabbage plant that started that head was planted in a greenhouse in the middle of March, so it's almost a year old.
You usually leave the cabbage growing before you take it to sell for use.
60 to 120, depending on the variety.
Why did that one stay so long?
Because it's a long growing variety, and then it's made for storage. So we've been keeping it in storage since then. Okay. The next item of the agenda is approval of the minutes, unless there's any other questions. You have the 28th of January's minutes before you. They stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 14-0085, authorized contracts.
Moved by Legislator Dr. Carbone, second by Legislator Marinetti. Any questions? Legislators Andrews.
Thank you, Mr. Chair. And through you to the administration, could we just get a little explanation of why this referral is coming to us this year? And my understanding is there's been the use of temporary help at the hospital for quite a few years, but why is it this year that we'll be voting on it?
Through the chair, I can attempt to answer that, ma'am. In previous years, this was put out for bid in the non-RFP methodology, and upon re-examination, it was felt that the RFP was the more appropriate way to go. It last went out as an RFP, I believe, in 2002. Between then and now, in the interim years, it was done simply by contractual bid through the purchasing department.
Thank you. And through the chair, just 2 other questions. One, sir, if you could please identify yourself for everyone here who may not know you. And then number 2, also, is the dollar amount that's being spent on temporary help at the hospital increasing under this proposal, or is it remaining about the same?
Through the chair, I'm Gene Larrabee, Executive Director of Monroe Community Hospital, and the dollar amount budgeted is approximately consistent with the level of 2013.
Thank you very much.
Any other questions? Legislator Keeley.
Thank you, Mr. Chairman, and through you to the administration, if you would, I just wanted on the record what the approximate amount in fees would be during a given year.
I'm sorry, because your microphone, I didn't hear the entire
Sorry.
question.
Are we on now?
Yes.
Okay. As was asked prior, I just wanted on the record the approximate amount of fees that would be paid through a year's contract.
Through the chair, the budgeted amount is $975,000, and it is anticipated that the total amount expended would equate to that figure.
Thank you.
Any other questions? Seeing none, those all in favor, say aye. Opposed? Motion carried. Next item, please.
Referral 14-0086.
Moved by Legislator Marinetti, second by Legislator Draw. Any questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item, please.
Referral 14-0087. Amend
Moved by
resolution.
Legislator Draw, second by Legislator Quattro. Any questions? Legislator Kaley.
And now I'll back up. Could you, could I get through the administration a brief or short explanation as to other program support costs?
Through the chair, could you restate your question?
Yes, through the chair, there is, in the second paragraph, says the additional funding will be used to support public health, existing salary benefits, and other program support. I was just asking for an idea of what the other support costs were.
Yes. Through the chair, I guess maybe the other support costs, will go towards salaries, I guess maybe and benefits for this specific amount of money, and then for the original, I guess maybe amount of money, that included those as well, but including additional supplies, which could include, resources, for the actual testing and the maintenance of the actual equipment that's used in the testing, funds that are used in terms of interpreting the services, training not only of our staff, but also I guess maybe other staff in the community, stuff that includes maybe postage, maybe for mailing, radiation badges, and the like.
Thank you. And then, given that there's been such a great level of success with lead poisoning prevention, could, through the chair, could we get an update, certainly not today, but in the future, of the last, I think the last figures were 2011, or were they 12? Could we get an update when those figures are available for what testing has shown up to date?
Through the chair, we'd be happy to provide that.
Thank you.
Any other, excuse me, any other questions? Seeing none, all those in favor say aye. Opposed? Motion carries. Next item, Madam.
Referral 14-0088. Acceptance of a
Moved by
grant.
Legislator Quattro, seconded by the President Adair. Any questions? Legislator Andrews, I think, was first.
Thank you, Mr. Chair. Through you, could someone explain what tests currently exist to test for the bath salts and synthetic marijuana compounds, please?
Through the chair, there are a number, I guess maybe of tests, I guess maybe for testing for the bath salts and the synthetic marijuana. And part of the reason maybe for that is because oftentimes when certain chemicals are specified, folks that are in the community, who are trying to identify or create new derivatives that are not necessarily and specifically covered by the existing tests that we have. So that actually presents a challenge to our forensic toxicology labs in terms of being able to develop tests that can test these new derivatives. And so that's ongoing, so because we know that it's ongoing actually out on the streets.
Thank you. Through the chair then, so one of the purposes of this would be then to continue the development of new tests to increase our abilities to test for those.
Through the chair, that is correct. Not only maybe to develop those tests, but also to develop validation methods. Many of the tests that we have, in many cases, they cannot be admissible to be in court unless you actually have a complementary test that actually confirms those. And so either you have to have another independent test that confirms a similar type of compound or another test that confirms a different dose. And so you have to have more than one, I guess, maybe source of testing in order to make it admissible.
Thank you very much.
I believe Legislator Kaley was next.
Thank you, Chair, through you to the administration. And as I guess a sidebar to this type of development of the testing, do you also spend time, or does the county spend time in actually looking at what, in advance, what some derivatives might be to sort of look forward in developing testing of other substances that might be included in these drugs?
Through the chair, we do, and then some of the instrumentation that we use, including gas chromatography and mass spectrometry, that allows you to identify, if you will, like a unique signature pattern, for specific compounds. And so although you may have a unique signature, you might not be able to have an identity of that unique signature. And so that requires us maybe over time, to regularly update those signatures with known information that's out there, either from the state or from the federal databases, and we do that often.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carries. Next item, Madam Clerk.
Referral 14-0089, acceptance
Moved by
of
the President Adair, second by Legislator Cabone. Any questions? Legislator Carey.
Thank you very much, Mr. Chair. Through you to the administration, I know that this has been, as stated, the 7th year that the county has received this grant, and I just want to make sure on a couple points that I'm familiar with a program that's called CERT, Citizens Emergency Response Team, and are we talking about the same programming here for civilian response?
Through the chair, I believe that that's a different program. In this particular program, it focuses more on specifically a medical reserve. And in that particular realm, oftentimes, the universe of folks who are in the database for volunteers are maintained at the state level, and then we maintain our own, if you will, community level for Monroe County.
Okay, thank you. And then would you, through the chair, would you be able to supply, certainly not now, the numbers of trainees that have gone through this program and perhaps a stab at the retention?
Through the chair, what I can tell you is that, back in 2012, we had about 320 registered volunteers, and that number was increased through in 2013 to 359.
And then through the chair, in 2012, would that have been the total amount trained over the 7-year period? Or are we looking at some folks that perhaps have been trained that have dropped off the list or the radar?
Through the chair, that would include, I guess, maybe both folks who were newly trained, but also folks who were trained previously but were retained in the database as active volunteers, ready to be tapped into in the case of some preparedness event.
All right, thank you.
Anybody else have any questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item.
Referral 14-0103,
Moved by Legislator Cabone, second by Legislator Marinetti. Any questions? Legislator Lightfoot, you got
Thank you,
up
Mr.
there
Chairman.
before the two ladies there.
Thank you, Mr. Chairman. Through you, Mr. Chairman, to the administration, is this the first time, well, why are we receiving this additional funding for this grant? Through you, Mr. Chairman.
Through the chair, this is the 20th year that we have received this grant, and this additional funding allows us maybe to cover for added costs, including salaries and benefits.
Thank you. Through you, Mr. Chairman, is that administrative costs or services? How many administrative positions are we, or services are we adding in addition with this funding? Through you, Mr. Chairman, to the administration.
Through the chair, I guess maybe it contributes to existing, I guess maybe partial, I guess maybe funding for those, but also it contributes to, on certain things that we previously had received from New York State that were for free. For example, we were receiving from the New York State Department of Health HIV test kits, and they have since, I guess, took those away not only from us, but other maybe counties in New York State. And so part of this funding will actually maybe contribute, I guess, maybe to the purchase of those kits as well, in addition to what I stated earlier.
And thank you. Through you, Mr. Chairman, to the administration, the public health campaign program, the use of the word campaign, are there any actual marketing things that the county is doing concerning this particular grant to the public? Through you, Mr. Chairman, to the administration.
Through the chair, we had considered doing, specific types of targeted campaign media. The problem with this particular grant was because of the fast-moving timetable for which we actually had to get approval from New York State because of some additional funding that they had left over. And so in talking with them, we had to negotiate, what we could actually do in a quick turnaround period. That was also within the scope of the original grant. And so that's why, we were sort of restricted to what I stated earlier. That being said, I guess it's part of our normal, maybe work in public health, maybe to be engaged in campaigns that focus on HIV, STD in general.
Okay, so thank you. So through you, final question, through you, Mr. Chairman, to the administration, that's very interesting. Am I understanding this correctly, that because of the time frame, this particular grant could fund those type of activities of campaigning? Is that true?
Through the chair, I guess, before we could receive the grant from New York State, we had to actually write a proposal for them in terms of what they would allow and what they would sign off on, again, under the time constraints that we had to work under.
So for next year, potentially, through you, Mr. Chairman, is it, being that we could be more aggressive, is it possible that we would be trying to get ourselves in position where we're able to do more of the media piece maybe for next time, through you, Mr. Chairman, to the administration?
Through the chair, absolutely.
Okay, thank you.
Legislator Andrews.
Thank you. And through the chair, how much was lost from the state in terms of purchasing for the STD kits?
Through the chair, I can provide an estimate for you.
Thank you. Through the chair, then, has the county had to make that up with local dollars?
Through the chair, could you repeat your question?
Through the chair, has the county had to make up whatever funding was lost from the state with local dollars to purchase the STD kits?
Through the chair, I guess that loss of kits that just recently happened with this ongoing year. So to your question, I guess no, not yet.
Thank you. Through the chair, then, is it your expectation that you will have to, or will you just get by with fewer kits? Or can you explain what you expect the ramifications to be from that cut?
Through the chair, we expect maybe to use, I guess, maybe this funding and also some of our other funding that we have within our programs, for those areas, in order to provide maybe the testing, I guess, maybe as needed. Again, that's part of our scope of work, I guess, that we've been ongoing.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item, Madam Clerk.
Referral 14-0104.
Moved by Legislator Marinetti, second by Legislator Draw. Any questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item.
Referral 14-0105.
Moved by Legislator Draw, second by Legislator Quattro. Legislator Andrews. She was moving.
Thank you, Mr. Chair. Through you, if I recall correctly, this is a relatively new program, and I just wanted to ask how it's been going over the past couple of years and what sort of success you've had in your outreach.
Through the chair, this is a relatively new grant. We've been having success in terms of being able to have, to reach roughly about 750 to about, 800 and some individuals per year. And that is through various means. Some of that includes focus groups. Some of that includes identifying, I guess, folks, who would benefit, through testing and subsequent linkage. Some of that includes, I guess, identifying folks not only who have positive test results, but folks who are potentially high risk who need to be tested.
Thank you.
Any other questions? Legislator Lightfoot.
Thank you, Mr. Chairman. To you, Mr. Chairman, to the administration, is some of this grant monies used for AIDS Care Rochester? Are there any collaborations with that concerning this grant? To you, Mr. Chairman, to the administration.
Through the chair, yes, that is correct. Through for AIDS Care, now renamed Trillium,
Right.
they are one of our partners, as is the University of Rochester, as is ACM Laboratories.
Right. I'm just wondering because through my works here, some of the things that I do with the Cut the Violence program, we have the HIV van come out and do testing in this targeted areas. And I was wondering if that van is a part of this whole grant. Through you, Mr. Chairman, to the administration.
Through the chair, yes, that is correct. So we do have, another contractor that actually provides maybe a mobile van, AC Center, that actually goes around, and part of their role is to sort of go out into the community, as opposed to with the other contract, with the University of Rochester, they come to a specific clinic. And so we realize if you really want to have an impact, you not only have to provide a clinic where folks can go to, you also have to go out to where they are as well. And that's part of how we do that through the mobile van.
Well, I just want to commend that effort because I've been doing the HIV testing with my events now for about 2, maybe 3 years, and we're actually having one Thursday at REOC, and the van will be there. I want to say that I've seen over the 2 or 3 years the change of people not wanting to go nowhere near that van to people now actually asking when's the van coming, wanting to be a part of that and get tested, and it's kind of a thing that they're actually talking about now. So I think it's very successful. I hope it continues, that outreach, because it's working.
Through the chair, thank you. We appreciate that.
Legislator Keeley.
Chair, I realize it's a young program. Statistically, if you looked at the number of cases prior to this program starting and the number of cases that were caught after this program started, would you be able to determine a decrease, a significant decrease, or a marginal decrease that would begin to I believe, the success in this program, but to statistically provide information on the success of the program?
Through the chair, certainly, one of the goals maybe is to prevent maybe transmission of disease and the consequences of that. And along with that latter, I guess maybe goal, you can't really have reduced complications unless you identify, someone's status in the first place. And so that's why, a central piece of this effort is really to identify folks who have undiagnosed and unrecognized disease, and hence, the purpose of the screening and the testing and the appropriate linkage to that. So the fact that we know that, through this program, we've identified folks who've had new disease that they previously did not know about, that we believe is also an indicator of success.
No, and I agree. Thank you, through the chair. I mean, I basically am agreeing with that. I realize there are a lot of different parts to this that will show success. And I guess I'm hoping that we'll be able to
Put a number to it.
put a number to it, a statistic to it that shows all the different levels of the success that a program like this could have. Because certainly that just communicates it. Some people just think in straight numbers, up or down, what's happening. And I totally agree with what your assessment of success is. And it's easier to not sell it, but to show success in numerous ways. So thank you.
Through the chair, thank you, and we appreciate those comments. And we're looking at multiple ways in terms of how to evaluate success.
Any other questions? Seeing none, all in favor, say aye. Opposed? Motion carried. Are there any other matters to come before this committee? There are no other matters to come before this committee. The February 25th committee of the Human Service Committee stands adjourned. The next meeting of the Human Service Committee is scheduled for March. Don't have a date here.
25th.
25th?
Yep.
Stand adjourned.